As outlined by the NAEYC, Standard 5 clearly explains that programs should ensure the nutrition and health of children as well as adults are encouraged so as to keep them safe from various forms of injury and illnesses. Much headway has been made in Caribbean islands towards ensuring the health and safety of children are met. For instance, in Grenada, the Ministry of Health, together with the Ministry of Education, have set guidelines as it relates to the immunization or vaccination of children. It is mandated that all children should be provided with the necessary approved vaccines such as measles, mumps, rubella, and polio shortly after birth or by school age. Additionally, since the onset of COVID-19, national protocols have been put in place to ensure that there are safeguards against viruses and the way it is transmitted. For example, Part A 1E of the updated COVID-19 quarantine, isolation, and vaccination guideline speaks to frequent hand washing and sanitizing, while other aspects of the document addresses areas such as covering of the face, mandatory testing, quarantine, isolation, and vaccination. Further to this, the laws of Grenada, as stated in the Education Act, Section 33, speaks to the administrator's right, both in public and private schools, to refuse admission and attendance of children who suffer from or have been exposed to contagious diseases. In addition to these, efforts have been made by the Ministry of Education to create a nutrition policy together with the Ministry of Health, with healthy eating being the focus. Policies and programs have been created to ensure that children's meals are nutritious and balanced, and that children whose families are unable to provide for them are fed daily. Now, despite having these policies and laws in place, gaps still exist in health practices. For example, in Grenada, there have been several medical reports of instances where children of preschool age are not properly vaccinated, even up to the period just before they enter the primary level. Two major reasons explained for this are parental negligence and a lack of resources at the medical facilities. Additionally, evidence shows that schools and parents of families, especially those who live in poverty or from a low socioeconomic background, express how costly it is to provide healthy snacks for children. Thus, they take the cheaper route by providing artificial snacks and meals to the children daily. Resultantly, school nutrition policies are not strictly adhered to, and so children continue to be exposed to health issues such as dental cavities, obesity, and diabetes, thus affecting their maximum growth and development. Further in this presentation, we will be enlightened on some recommendations or solutions to addressing these gaps mentioned.